Assalamu alaikum students. Okay, in today's class we'll discuss about the anatomy of the suprarenal gland, the gross anatomy, as well as the developmental anatomy of the this adrenal gland. So this is the objective related to this topic, that is the anatomy and embryology of the adrenal gland. So as you know, the adrenal gland is also called as the suprarenal gland. Suprarenal because it is above the kidney. Supra means above, renal is the kidney. So it is above the kidney, sitting on the top of the kidney, at the upper pole of the kidney. There is a kidney here on either side, and you can see this gland called as the suprarenal gland, or it is also called as the adrenal gland. So if you see the structure of this adrenal gland or the suprarenal gland, it will look yellowish in color. As you can see here, it is almost yellowish in color, and it is retroperitoneal because it is above the kidney. The kidney is retroperitoneal. So similarly, even the gland above that, that is the suprarenal gland or the adrenal gland, which is sitting above the kidney, is also retroperitoneal, just like the kidney. That lies on the upper pole of the kidney. Okay, as we said, they are surrounded by renal fascia. So there is a fascia covering the kidney, that is called as the renal fascia. The same fascia will continue above and even cover the suprarenal gland. It not only covers the kidney but also the suprarenal gland. Okay, this is called as the renal fascia. The fresh section of this adrenal gland shows that it is formed of two layers. So if you cut it and see, then you can see two layers here. One is called as the yellow peripheral layer called as the adrenal cortex. So if you see here outside, we have the adrenal cortex, and inside we have the reddish brown central layer called as the adrenal medulla. So when we take a section of this, you can see two parts. Outside we have the cortex, and inner part is called as the medulla. These two parts are very important. Okay, the right suprarenal gland is pyramidal shape. If you see the right adrenal gland is the right kidney, and above that is the right suprarenal gland. So this is almost pyramid in shape with the three ends. Okay, and caps the upper pole of the right kidney, and it caps at the or sits on the upper pole of the kidney. The left suprarenal gland is crescentic in shape. If you see, there is difference between the right and the left suprarenal gland in shape. The right suprarenal gland is pyramidal in shape, and the left one is almost crescentic in shape. Crescentic means half moon shape. It looks like a moon, half a moon. Okay, so that is called as crescentic shape, and extends along the medial border of the left kidney. And if you see, it is more on the medial side than on the upper pole. So it not only sits on the upper pole but also comes on the medial side of the medial border of the left kidney from the upper pole of the hilum. Okay, so from the upper pole up to the hilum. Hilum is this part. Hilum is that part of any structure where the structures will enter or coming out. So this is called as the hilum of the kidney. So this left suprarenal gland not only covers the upper end of the kidney, but also covers all the way up to the hilum of the kidney. So this is the difference in shape between the right and left kidney. Right kidney is pyramidal in shape, and it is at the upper pole. Coming to the blood supply, the arterial supply of this suprarenal gland or the adrenal gland is inferior phrenic artery, then the aorta, direct arteries from the aorta, as well as the renal artery. So there are many arteries coming from the different parts. One is from the phrenic artery. Phrenic artery will supplying the, so if you see here, there is the phrenic artery here, inferior phrenic artery, and the vein. So it will be giving some branches here. So branches from the inferior phrenic artery, so which will be giving the branches to the suprarenal gland. This is the superior suprarenal artery coming from the inferior phrenic artery. Then directly from the aorta, there will be some branches coming directly to the suprarenal gland. Then even the renal artery is that artery which is supplying the kidney. So it is giving some branches to the suprarenal gland. So if you see here, these are the middle renal artery which is coming directly from the aorta. Aorta is here. This is the inferior vena cava. This is the aorta. So there are direct branches from the aorta, and then there are branches from this is the renal artery giving branches to the suprarenal gland. So there is superior suprarenal artery coming from the inferior phrenic artery, direct branches from the abdominal aorta cortex. This is called as the middle suprarenal artery, and the branches from the inferior the renal artery, which is called as the inferior suprarenal artery. Superior, middle, as well as inferior renal artery, suprarenal arteries, which are supplying the suprarenal gland. Coming to the venous drainage, it drains into the inferior vena cava on the right side and into the renal vein on the left side. Okay, so if you see, inferior vena cava is very close to the right suprarenal gland, so it will drain directly through the suprarenal vein into the inferior vena cava. So now, if you see here, this is the kidney, and here is the suprarenal gland, and it will drain directly into the inferior vena cava. Here is the inferior vena cava, this big vein. But if you see, the left kidney is very far away, and the left suprarenal gland is very far away. So this left suprarenal vein will drain into the renal vein. This is the renal vein. So left renal vein is a very long vein because it has to cross the aorta and then go to the inferior vena cava. So the left suprarenal vein does not drain into this inferior vena cava, but directly into the renal vein, from there into the inferior vena cava. So there is a difference between the left and right renal veins. It drains into the inferior vena cava on the right side, but into the renal veins on the left side. Coming to the lymphatic drainage, the lymph drains into the lateral aortic nodes. So there are a group of lymph nodes just beside the aorta, So those are called as the lateral aortic. There are pre-aortic and para-aortic. Pre-aortic means in the front, para means beside, and lateral or the para-aortic group of lymph nodes which are beside the aorta. So these suprarenal glands on either side will drain into the lateral aortic group of lymph nodes. Coming to the nerve supply, it will be by the preganglionic sympathetic fibers derived from these splanchnic nerves supply the gland. So there are preganglionic sympathetic fibers derived from the splanchnic nerves which will supply the gland. Most of the nerves end in the medulla. If you see here, they are preganglionic sympathetic fibers. Okay, so where are the postganglion fibers? Because this preganglionic sympathetic fibers directly end in the medulla. So the postganglion fibers are actually the medulla, which are forming the medulla. Later you'll see during the development how the postganglion fibers have themselves modified into medulla. So this is very unique for the suprarenal gland, that it is supplied by the preganglion fibers. Preganglion fibers, which are before the any ganglion, and postganglion fibers are which are laying from the ganglion. Usually the postganglion fibers will supply the any of the different organs in the abdomen, but here it is supplied by the preganglion fibers. Why? Because I said the medulla itself is formed by the postganglion fibers. We'll talk about that. Now coming to the development of the suprarenal gland. So how the suprarenal gland develops? Okay. So if you see the cortex, which is the outer covering of the suprarenal gland, the coelomic epithelium between the dorsal mesentery of the gut medially and gonads laterally proliferate to form the fetal cortex. If you see here, so this is the mesentery. Mesentery means the peritoneal covering, which is covering the intestines, especially the intestine. So during development, so this is during development, okay, in the fetal life. So this is the part of the gut, and this is the mesentery. And if you see here, there are some organ plexus which are coming from here. Okay, so the coelomic epithelium between the dorsal mesentery, this is the dorsal mesentery of the gut, medially, and the gonads laterally proliferate to form the fetal cortex. And if you see here, developing fetal cortex cells. So these cells are all going here, and they are proliferating here, which form later we'll talk about that, it will form the renal cortex. So they are all coming from the dorsal mesentery. 1 week later, the coelomic epithelium proliferate to form the definitive cortex, which surround the fetal cortex. So if you see here, initially there is development of the fetal cortex. This is the fetal cortex here. Now it is modified to form this. So if you see here, this is here is the fetal cortex, and this is the adult developing cortex. Now, when once the developing cortex is formed, the fetal cortex is absorbed, and the whole of the thing is covered by the adult cortex. So 1 week later, the coelomic epithelial epithelia, which are coming from here, proliferate to form the definitive cortex. As you can see here, they are forming the definitive cortex, and which surround the fetal cortex. If you see here, this is the fetal cortex. It is covering the whole of the fetal cortex here. Okay, now coming to the medulla, how the medulla is formed. The cells from the neural crest, that is the ectodermal, migrate and invade the medial aspect of the cortex and become arranged into cords and masses that form the medulla. If you see here, the neural crest cells, which are also called as the chromaffin cells, they are migrating here. So here also, if you see here, there are chromaffin cells. They are chromaffin cells. The neural crest cells or the chromaffin cells precursors, they migrate here toward the fetal cortex, and then they modify themselves into the medulla. Cells from the neural crest cells migrate and invade the medial aspect of the cortex and become arranged into cords and masses that form the medulla. Okay. So after birth, the fetal cortex disappear and the gland becomes smaller. The definitive cortex divides into 3 zones. If you see here, so here is the definitive cortex, this is the fetal cortex, and this is the medulla. So as there is development, the fetal cortex, the adult cortex will cover the fetal cortex, and slowly the fetal cortex will disappear. Now there will be only adult cortex and the medulla, which is from the neural crest cells. So these neural crest cells are nothing but the nerve fibers, which are the postganglion fibers here. So the postganglion fibers, which are forming the medulla, and the adult cortex will be divided into 3 zones. Zona glomerulus outside, in between is the zona fasciculata, and the innermost will be the zona reticularis. So these are the 3 zones of the cortex, and the inner part, which is coming from the neural crest cells, which are nothing but the nerve cells, postganglion fibers, which are also called as the chromaffin cells, will form the medulla. So if you see here again, these are the chromaffin cells coming migrating. These are nothing but the neural crest cells. They're coming here and they form the medulla part. Okay, and the cortex, the fetal cortex, here is the fetal cortex, this is the adult cortex. Now this whole thing will be replaced by the adult cortex. So this is the adult cortex, and it will have 3 zones: zona glomerulus outside, zona fasciculata in between, and the innermost will be zona reticularis. These are the 3 zones, and this is the medulla part. Okay, so after birth, the fetal cortex disappears and the gland becomes smaller. The definitive cortex divides into 3 zones, which we have seen. Okay. Now coming to the adrenal cortex, as we saw, it is divided into 3 zones. In case of adults, there are 3 zones within the adult cortex. This is the whole suprarenal gland. Inner we can see we have the medulla, and outside we have the cortex. We have the cortex, and inside we have the medulla. This is the section of the same. So inside we can see the medulla, and outer we have the cortex, which is divided into 3 zones: zona glomerulosa, zona fasciculata, and zona reticularis. So similarly, if you see under the microscope, this is how it looks like. Okay, so here if you see here, this is the capsule. Outside covering is by capsule. Then there, just deep to that is the zona glomerulosa, fasciculata, and reticularis, and the innermost will be the medulla. So the same is stained here with a special stain to make out the differences. So this is the capsule. This is the zona glomerulosa. This is the large zone called as the fasciculata, and the innermost of the cortex will be the zona reticularis, and inside we have this is the medulla. Okay, so now coming to the zona glomerulosa, this is the zona glomerulosa, which occupies almost 15% of the cortical volume. So out of the whole volume, almost 15% is occupied by the zona glomerulosa, which will be directly under the capsule. As we saw, this is the capsule here. So just under the capsule with the zona glomerulosa. The second layer, which is the largest layer, is called as the zona fasciculata. This is the largest layer. It occupies almost 80% of the cortical volume. It occupies almost 80% of the cortical volume, and this is called as the cortical mid zone. Cortical mid zone. This is the large zone here. Then the zona reticularis is the innermost zone here, which occupies just 5% of the cortical volume, and this is the innermost layer. Okay. So this is how the three layers of the cortex are there just under the capsule. Now coming to the medulla, innermost. Okay, so here is the medulla. Here is the medulla. Now if you see the same layers here, so the outside we have the capsule, zona glomerulosa, this is the fasciculata and reticularis, and this is the reticularis, and deep inside here is the medulla. Okay, so if you see under the microscope, this is how it looks like. The cells of the medulla are different from that of the cortex. Okay, this adrenal medulla is formed of something called as chromaffin cells. Chromaffin cells. Okay. So these are chromaffin means they take stain, special stain. So that's why they are like the stain. So that's why they are called as the chromaffin cells. They are polyhedral cells arranged in cords or clumps. If you see here, they are polyhedral. Okay. Cells. Okay. Because they have different surfaces and they are arranged in clumps, in groups, or sometimes in chains. Okay, sometimes in group, sometimes in chains. Okay, the medullary cells arise from the neural crest cells, as we saw before during development. So these are coming from the neural crest cells. These chromaffin cells are coming from the neural crest cells. Have secretory granules. If you see inside, there will be secretory granules containing catecholamines, epinephrine, norepinephrine, proteins called as the chromogranins, dopamine, enkephalins, as well as the adenosine triphosphate (ATP). Okay, so all these are present within these medulla, and they're stained brown with potassium dichromate. This is the special stain which, with when they are stained, they are stained brown. Okay, so because they are stained with potassium dichromate, that's why it is they are called as the chromaffin cells. They have few ganglion cells. Okay, so they will have few ganglion cells within them. Okay, then also there will be reticular fibers. In between there will be network of the reticular fibers as well as rich capillary network. So there will be, because this is an endocrine gland, this is acts as endocrine gland. So naturally, like any endocrine gland, this will be richly supplied with blood. So here also you can see a lot of capillaries inside these spaces. What you are seeing are nothing but the capillaries, thin walled vessels. Okay, where there can be easy pouring of the secretion from this endocrine, that is the hormones. Now coming to the hormones secreted by the adrenal gland, the adrenal cortex. Okay, so the adrenal cortex will be secreting some very important hormones. Which are those? One is, the first is the aldosterone, which is also called as the mineralocorticoid, secreted by the zona glomerulosa. The outermost layer, this is the zona glomerulosa, which you saw here. This is the zona glomerulosa. This will secrete the aldosterone. What is the function of the aldosterone? It maintains blood electrolyte balance. It maintains a very important component of the body, that is the electrolyte balance, that is the sodium and potassium control, so that it can control the blood pressure itself. They stimulate reabsorption of the sodium from distal convoluted tubules of the kidney, gastric mucosa, as well as the salivary glands. They stimulate reabsorption of the sodium. If there is a deficiency of the sodium, because they have to regulate the amount of sodium and potassium, so they help in the reabsorption if there is any deficiency of the sodium from the distal convoluted tubules of the kidney. Then also from the gastric mucosa as well as the salivary glands. Okay, and the main control is by the angiotensin 2. Angiotensin 2. Coming to the second hormone secreted by the adrenal cortex, that is called as the glucocorticoids, or they are also called as the cortisolon, or they are also called as the corticosterone. Okay, so these will be secreted by the zona fasciculata, the largest layer, the biggest layer. Zona fasciculata, almost 80% of the whole cortex. So this is the zona fasciculata, which will be secreting this cortisol or the corticosterone. Okay, this is the zona fasciculata, which is secreting the glucocorticoids. So the general function of these Glucocorticoids will be increase availability of the glucose and fatty acids. Okay, especially in response to stress. Whenever there is stress, there is stimulation of this part and the secretion of the glucocorticoids, which helps in the availability of the glucose and fatty acids. The main control of these glucocorticoids will be by the pituitary adrenocorticotropic hormone, that is the ACTH, adrenocorticotropic hormone secreted from the pituitary gland. So that is called as the ACTH. Okay. The third hormone secreted by the adrenal cortex is the androgens, as well as even some cortisols, not only from here, but also from the zona reticuli. Zona reticuli will be secreting the androgens. The function and control similar to the hormone secreted by the zona fasciculata. Their function is very similar to that of the glucocorticoids. Now coming to the hormones secreted by the medulla. Till now, what we are studying were the three hormones secreted by the three types of hormones secreted by the three layers. Okay, zona glandulosa, fasciculata, and reticularis secreting the aldosterone, glucocorticoids, as well as the androgens. Now coming to the medulla. So what will the medulla secrete? The hormone secreted by adrenal medulla are epinephrine, which is also called as the adrenaline, as well as the noradrenaline. These, as you know, are secreted by the neurons. Okay, so these, because the adrenal medulla is made up of neuron or the neuropus cells, so they will be secreting these hormones called as the epinephrine and norepinephrine, also called as the adrenaline as well as noradrenaline. Both are catecholamines. Okay. The general function of these hormones is in acute response to stress. There is acute response to stress, so these hormones will be secreted. The main control will be on the preganglionic sympathetic innervation. Usually, this will be within the preganglionic sympathetic innervation, it will be secreted. Okay, so these are the epinephrine and norepinephrine. Okay, now coming to the process of how these hormones will actually function. So if you see here, this is the angiotensinogen secreted by the liver. So then the renin, whenever there is renal ischemia or decreased blood supply, then it leads to secretion of the renin, which will convert the angiotensinogen to the angiotensin 1. Now this angiotensin 1 is converted to angiotensin 2 in the lungs by the secretion of the angiotensin converting enzyme, which is produced in the lungs. Now this angiotensin 2 will help in the arterial constriction, vasoconstriction, or increased production of the aldosterone, which leads to the hypertension or regulation of the blood pressure. Okay, so now coming to the chromaffin system. We studied that the medulla, adrenal medulla, is made up of the chromaffin cells. Okay, now we'll study the chromaffin system itself. So what is this chromaffin system? Chromaffin system is a group of cells which stain brown with potassium bichromate. As we saw, the adrenal medulla is stained brown with the potassium bichromate, so they are called as the chromaffin cells. Similarly, any cells, any group of cells which stain brown with potassium bichromate, those are called as the chromaffin cells. There are special cells which take up this stain. This is called as the chromaffin reaction. So whenever they are stained with potassium bichromate, then this reaction is called as the chromaffin reaction. And the cells are called as the pheochromocytes. The cells which take up this stain, they are called as the pheochromocytes, or they are also called as the chromaffin cells. Just like the cells of the medulla, okay, there are some other cells in the body which take up the same potassium bichromate and they stain brown. Okay, so they undergo the chromaffin reaction, and these cells are called as the pheochromocytes, or they are also called as the chromaffin cells. So this chromaffin system is made up of cells in different parts of the body. One we saw in the suprarenal medulla or the adrenal medulla, there are chromaffin cells or the pheochromocytes. Okay. Similarly, we can also see these kind of cells in the paraganglia. So we also see them in the paraganglia, as well as the para-aortic bodies. Para-aortic bodies. Within the para-aortic bodies, We can see these chromatin cells as well as the coccygeal body. They are very small bodies, but they are still present in some important areas. Okay. Then masses of cells scattered among ganglia of the sympathetic chain, splanchnic nerves, autonomic plexus, and close to the organs like the liver, heart, kidney, ureter, prostate, epidermis, etc. So all these cells which take up these similar the potassium bichromate they are stained with the brown with the potassium bichromate, and they undergo the chromaffin reaction, and hence they are called as the chromaffin cells or the pheochromocytes, and altogether these are called as the chromaffin system. So if you see what is the common factor in between all these cells, are they develop from the neural crest cells. So all these cells which we have seen, the renal medulla or the paraganglia or the parietic bodies or the coccygeal bodies are masses everywhere here. So all these are developing from the neural crest cells, and they secrete the adrenaline as well as the noradrenaline. So they are developing from the neural crest cells, and just like the preganglion cells, they will be secreting the adrenaline as well as the noradrenaline. Now coming to some applied aspects related to this topic, that is the suprarenal medulla. Because it will be secreting some very important hormones, it will also give some very important applied aspect depending on their excessive secretion as well as the decreased secretion. Okay, so the first example of this is the Addison's disease. Addison's disease. This is because of the deficiency of the mineralocorticoids. Mineralocorticoids. You see here. So if you remember, the mineralocorticoids are separated by the zona glomerulosa. Okay, zona glomerulosa, which will be maintain the electrolyte balance. Okay, so these, if there is any deficiency of these uh, uh, deficiency of this mineralocorticoids, it will be caused by the destruction of the both the glands. Usually, this is caused by the destruction of both the glands. If one side is destroyed, this might not affect much because the other side, the adrenal cortex, will compensate for that. But if both the glands are destroyed, then it can lead to this condition called Addison's disease. And how this will be represented? It will be represented clinically by the increased skin pigmentation. And if you can see, these kind of patients with Addison's disease will have increased skin pigmentation, muscular weakness, weight loss, as well as the hypotension. Increased skin pigmentation, muscular weakness, weight loss, as well as the hypotension. Then the second conditions after the Addison's disease is the Conn's syndrome. Conn's syndrome. This is just the opposite of the Addison's disease. Here there is excessive production of the mineralocorticoid. Here there is a deficiency of the mineralocorticoids, and here there is excessive secretion of the mineralocorticoid secretion. Okay. This leads to the symptom just opposite to the Addison's disease. Here there is hypotension, but here if you see, there is hypertension because there is excessive production of the mineralocorticoid, and as well as the hypokalemia. Okay, the function of the mineralocorticoids is regulation of the sodium and potassium. Okay, but here because of the excessive secretion, it leads to hypokalemia, deficiency of the potassium. Now, the third condition is called as the Cushing syndrome. Cushing syndrome. Okay, so very important disease or symptoms can be seen in this condition. This is the usually because of the pituitary adenoma, which leads to increased secretion of the adrenocorticotropic hormone. Then it leads to excessive secretion of the glucocorticoids. As we saw, the glucocorticoids. So you see here, the glucocorticoids are secreted by the largest layer, that is the zona fasciculata. You see here a big layer here. If you see here, this is the zona fasciculata, almost 80%, a very large layer. So this is secreted by the which is called secreting the glucocorticoids, and this will help in the increased availability of glucose and fatty acids in stress. Now, if you see, in case of the Cushing syndrome, there will be excessive, because of the pituitary adenoma, there will be excess secretion of the adrenocorticotropic hormone, which leads to excessive secretion of the glucocorticoids. And this leads to a condition called as truncal obesity. Truncal obesity. where there will be obesity, especially near the trunk, and also it leads to hypertension as well as the hirsutism in case of female. Hirsutism in females means excessive growth of the hairs, like the male hair, like the mustache, beard, everything. Okay, so this is called as the Cushing's syndrome. Then we have the androgenital syndrome, syndrome, where there's excessive secretion of the adrenal androgen. As you know, adrenal androgen are secreted by the innermost layer, okay, of the cortex, and that will lead to a condition called as the masculization of the female and precocious puberty in case of male. So, because there is excessive production of the androgens, it leads to muscular features in case of the females, masculization, that is means muscular features, male-like features in case of the females, and precocious puberty in case of male. In case of male, there will be excessive. Before the puberty, he will look like a man. Even before puberty, that is called as precocious puberty, where there is excessive development of the male features even before puberty. Okay, so there is early puberty. Then the last important applied aspect is called as the pheochromocytoma. So the cells, as I said before, these are called as the pheochromocytes or chromatin cells or the pheochromocytes. If there is any tumor out developing from this, then it is called as the pheochromocytoma, tumor of the medulla. Okay, because the pheochromocytes are the medullary cells, chromatin cells. So tumor of the medulla is called as the pheochromocytoma. In this condition, there will be excessive secretion of the catecholamines, which leads to paroxysmal hypertension. Okay, paroxysmal hypertension. So this is all about the renal cortex and medulla or adrenal gland or the suprarenal gland. Okay, so if you have any doubts regarding this, you can ask me. Do you have any doubts? Any questions?
No, doctor.
Oh, it's clear. Thank you.
Okay, thank you very much.